Thank you very much for everyone that's come along to our MPOX forum. So this is ACON Hunter in conjunction with the Western New South Wales Local Health District. We are putting on a forum to talk about sort of MPOX, what it is and how it impacts our communities. But prior to that, I would just like to acknowledge that we are all meeting on Aboriginal lands today. And myself, that's the lands of the Awabakal and Worimi people. I would like to pay my respects to their elders past, present and emerging, and extend that respects to any Aboriginal or Torres Strait Islander people who are joining us today. In light of obviously what week we're in today, it's always important to acknowledge that these lands were never ceded, and it always was and always will be Aboriginal land. So before we get into it, it is very important to note that we are meeting online today. However, you can interact with myself and the panelists through the Q&A function. So you can ask your questions through there if you do have any. Please do be respectful and confidential within those questions. As we go through, we'll endeavour to answer all of them. If you're not comfortable using the Q&A function, I believe you should be able to privately message myself and I'll ask the question to the panel there. So for tonight's agenda, we're going to do a little bit of a basic talk around what MPOX is, a little bit about the vaccine itself, how to access the vaccination within New South Wales, sexual health services in New South Wales or Western New South Wales more broadly, and then a little bit of a discussion about getting ready for World Pride and what that might look like. I'm joined here today by my two other fabulous panelists, Patrick Cashman. So Patrick, aka Paddy, is a nurse and immuniser coordinator with Hunter New England Local Health District. He has extensive experience in public health, Aboriginal health, remote health, infectious diseases, including HIV. He also helped develop the vaccine safety system and is the winner of the 2021 Public Health Association National Immunisation Achievement Award. Thank you for joining us today, Paddy. I'm also joined by the lovely Trevor Slattery. So Trevor is the coordinator of the Bloodborne Virus Prevention Program for Far Western and Western Local Health Districts, working primarily with the hepatitis services, sexual health teams and needle and syringe program, and a range of partner organisations. He is the co-convener of the New South Wales NSP Strategic Leadership Group and has been working in the health sector for 16 years. Thank you both for joining me today. So I thought I might kick things off with a little bit of introduction around MPOX, so a background around sort of where it is and what to look out for. So MPOX itself, I think it's important before we start getting into it is to discuss that there has been a name change. So previously, and what many of us are used to seeing would be the term monkeypox. It's very important to note that around November last year, the World Health Organization recommended that the name be changed to be in line with some best practice naming conventions around diseases. So in light of that, New South Wales Health and ACON as an organisation and all of the local health districts throughout New South Wales have begun transitioning to the name MPOX. Throughout today's presentation, you may see monkeypox still used. We are in a transitional period now, so some people will still say monkeypox, some people will say MPOX. You might also see MPXV, which was an acronym we were throwing around for a while. However, it is really important to note that this name change came in response to a lot of community consultation right across the world to avoid a lot of that stigmatizing language that we're hoping to move away from, especially now that we have much better conventions when we come to naming conditions. So please bear with us as we make that transition, and excuse me if I accidentally used the wrong term. So what is MPOX? So MPOX is a viral infection belonging to the same family of viruses as a very familiar condition known as smallpox. So many of us have probably heard of smallpox before, and MPOX kind of comes into that same family. It's important to note as well, and I think there was a lot of community concern when this started, that this, another sort of disease or virus has emerged out of nowhere. MPOX itself is actually endemic. So it's been endemic to many parts of Africa for many, many decades. So this is not a new virus. It's just that it is now starting to show new infections or onwards transmission in areas of the world where we weren't seeing it previously. In response to that, the global community, so the World Health Organization noted that there was a sudden uptake in new infections in areas we hadn't seen and sort of declared a health emergency. So as of sort of May last year, we've recorded about 84,000 cases globally, 144 of which have been within Australia, and 56 of those cases being reported to New South Wales. A majority of those cases that we're seeing in Australia are from returned or overseas travellers. We are, as many of us now know, very geographically lucky when it comes to viral infections, in that we are an island. So we're mostly seeing that local transmission has not occurred, due in part, and we'll speak about this later, to some really great community action and some very, very effective preventative health measures. So what we were seeing, especially during last year, was that a predominant number of these cases were impacting gay, bi, queer men who have sex with men. And in response to that, there was a number of sort of initiatives targeting those communities. And as a community globally, I think we responded really, really well. So we're now seeing an incredible decrease in the rate of onward transmission within our community, due in part, of course, to behavioural changes right at the beginning of that epidemic, and we'll speak about this later, but obviously, like I said, a very effective vaccine that we've now sort of uptaken. So what is MPOX and what to look out for? So unfortunately, MPOX shares a lot of symptoms with other viruses. So things like headaches, a general feeling of unwell, tiredness, muscle aches, swollen lymph nodes, all those sorts of things you may experience if you were to contract MPOX. What sets it apart, however, is the formation of sort of these rash-like or pimple sores that appear on our bodies. So these sort of pox marks is sort of indicative of an MPOX infection. These sores generally present on the hands, the face, the feet, and the genital and anus area, and are very easy to miss as well, since they're in some of those harder to spot areas. These lesions will usually start as a red rash that develops into pustules and form a crust before they eventually scab off. It is also important to note that we are still in early days of really looking at this particular outbreak, and there is now some evidence to show that MPOX may actually have a number of asymptomatic carriers as well, which is to say people who contract MPOX may show no symptoms at all. So it's really important to note that these symptoms will usually begin about a week after infection and are self-limiting. So we'll eventually, you will be able to sort of overcome them within about 21 days. And how does it spread? Sort of the next important part. So MPOX mainly spreads from people, or primarily what we saw is spread due to skin-to-skin contact, so direct contact. Previously, it was reported in those areas of Africa that we spoke about earlier, that it was primarily skin-to-skin contact or contact with contaminated materials that would have had bodily fluids on it. So things like bedding or clothing, potentially, and in very rare cases as well, droplets from the mouth may have actually led to new transmissions. However, what we're seeing within this outbreak is that it's primarily spreading through sexual networks. So this was not typical of what MPOX was considered to be, or how MPOX was considered to be spread. And so there was a lot of work early on last year to sort of say, all right, well, what is happening? And a lot of great contact tracing, and now some evidence coming out to show that the viral fragments are in semen as well, to demonstrate to us that yes, sexual transmission is actually the primary way that this particular outbreak is occurring. We know that because of contact tracing, so we can see that it's being spread through sexual networks. And like I said, a lot of research looking at that now, the viral fragments are found within semen. A really important part of this conversation, and I wanted to sort of get out of the way very early, is that it's really important to not stigmatize individuals or groups especially due to viruses like this. Queer people or LGBTQ people are very, very familiar with pandemics, and we're very, very familiar with the impact that stigma can actually have on our community. This is certainly not the first epidemic that we've gone through, and evidence has constantly shown us that we respond best to these health emergencies when we respond together as a community. So the purposes of these forums and these places is to educate us around sort of how to best look after ourselves, our partners, people we care about. It's not to stigmatize groups or to point fingers or anything like that. We're here to support one another and hopefully get as many people up to speed and educated as we can. Well, that's sort of the first little part of our section around what is monkeypox. Did anyone, I'll open it up, and I don't believe we've had any questions now, but I might throw across now, because you're all probably sick of listening to my voice, to Patrick or Paddy. So Paddy is going to talk to us today a little bit around the MPOX or monkeypox vaccine. So we've all probably heard a little bit around the MPOX vaccine. So I thought I'd start us off just by asking you, Paddy, so could you tell us a little bit around that background, around what the vaccine actually is?
Yeah, thanks, Lachlan, and thanks for that great background that you've just provided. That was really informative. The vaccine is fantastic because what it does is it helps our body prepare for any infection, and it's how our body defends itself. So we're using the natural defense mechanism of the body, and we're just stimulating with a vaccine. And vaccines is a really basic, standard way of giving healthcare. Nearly every infant in the world receives vaccines. Well, all the ones we can reach, and there's some we can't reach. We've got to get out there. But so it's not an odd thing. Now you think of COVID. Now when that COVID virus came, we didn't have a vaccine, and we had to shut down the world for 12 months while we made some vaccines, and then we vaccinated people and opened up. Now the good thing about MPOX is that we have a vaccine. So the virus has come, but we've got the vaccine already. So we don't have to stop what we're doing. We've got that vaccine ready to go. So the trick is to get people to have the vaccine. And so that's the really important thing. Now, the vaccine works really, really well. So it's a vaccine called Jynneos, and it's a vaccine, as Lachlan explained, that was prepared for smallpox, which was a previous infection that was actually eradicated from the world. It used to kill lots of people. And it also, like it's a pox-like virus, like Lachlan was describing. So it used to give you these terrible pox. And back before we had smallpox vaccines, like about before 200 years ago, a lot of people had terrible, terrible pock marks. And now we're all so beautiful because we don't have smallpox, we don't have pock marks, and we're just a much more beautiful race of people. And if you look, give a beautiful example of my lovely clear skin, because I've never had smallpox, because that's been eradicated through vaccine. So vaccines really, really got so many benefits. And and as Lachlan explained, the more people in the community that get the vaccine, the less that virus can spread around. And the community's been so responsible and in protecting each other and protecting people in other communities. So that's been fantastic. So the idea is that before you're exposed to that virus, you get that vaccine on board, you prepare your immune system, and then if you do bump into that virus, your immune system will be ready and it's not going to affect you. And you're not going to get sick, and there's much less chance that you're going to spread it to someone else. So it's about protecting you and about protecting other people, and potentially people that you care for. So it's really important. And in the past, we've had viruses that have come into communities. The community's been really, really responsible, and that virus hasn't got out. So back in the day, I used to work in HIV medicine, and there was a big worry in countries like in Europe and in the United States and here in Australia that virus would spread into the whole community, and it didn't, because the gay community was so responsible. Everyone did the right thing. Everyone protected each other, and that virus didn't spread into the rest of the community. So this community has a great record of looking after each other, looking after themselves, staying strong and healthy, and protecting everybody. And that's what the vaccine's about. And you want to be able to do what you want and make your own decisions with your life. You don't want to be ruled by a virus and the virus stopping you doing what you want to do. So you get the vaccine on board and live the life you want to live. And that's what, so during the pandemic, we sort of saw this thing, that the vaccine is stopping me being free. I want to live my own life and I don't want the vaccine. But in fact, it's the opposite's true. If you get the vaccine on board, you prepare your body, and then you can make your own decisions. You're not limited by what viruses are directing you to do. Thanks, Lachlan.
No, thank you. I think that you made some very good parallels. I think the parallel between HIV and MPOX is sort of been discussed a lot, and I think it's a really important parallel. And I think we mentioned early on, like you said, with HIV and with the early state and the early outbreak of MPOX, we didn't have a vaccine available straight away. So it really was up to community behavior sort of change to make sure that we stopped the onward spread or new transmissions of MPOX. And I think we saw as a community, we were incredibly good at that because that's something that we were familiar with. You know, we were already familiar with regular sexual health testing, obviously, and that's why we saw a lot of those initial infections come up through sexual health testing. But we also saw a huge amount of very quick and very responsive behavior changes, especially because this early epidemic happened around North America and Europe's Pride season, where we'd normally see very, very large dance parties and very, very large celebrations, and people were much, much more sensible and looked after each other and looked after their communities. So we managed to stop the onward spread of the virus so effectively before we even actually got access to that vaccine. So thank you for drawing that parallel. Another parallel that you draw as well was of course to smallpox, which we I bet probably have the best track record of any virus. I think at this point we've nearly all completely eradicated it.
Yeah.
Which is fantastic. And it's interesting that you bring that up because I think a lot of people, when they think of MPOX, they think of the smallpox and then they think of the smallpox vaccine or the cowpox vaccine, which is probably the first generation. I'm not sure how many people listening today received the cowpox vaccine. They potentially many, many, many years ago would have received that, but with that, they got quite a significant scar sort of up on their upper arm and then potentially had some quite nasty side effects. And I think, especially for our community of people living with HIV, side effects and interactions on their immune system is something that they do worry about. I was wondering if you could maybe talk a little bit about what side effects we might expect for when we are vaccinated.
Yeah, Lachlan, happy to do that. So do you want to bring up those
I will bring
slides that I showed you, and I'll just talk about vaccine safety. So I started a system of vaccine safety over 10 years ago that we ended up using during the pandemic. You can click again to bring up the great. That we used for COVID during the pandemic, and had it ready to go for MPOX vaccine as well. You can click again to bring up the next. That's it. Yeah, and just go back to the previous slide. Thanks, Lachlan. Sorry. The and we're able to produce Australia and the system I set up, which now sits under the OSVAC safety. So you can search for OSVAC safety and go to the public website, and it has all the data there ready. And we were able to produce the world's first vaccine safety on MPOX with the experience of people in Australia, which is just fantastic, and that data is used overseas. So we've got good experience now of the MPOX safety. So you can go to the next slide. Thanks, Lachlan. And what we found is that we get the information, we give the vaccine, and then we send people a text and say, hey, fill in this survey and let us know how you're feeling. And about half the people reported that they were absolutely fine, and about half the people reported they had a minor adverse event. Some people reported they went to the doctor, but no more than we would expect. And we've got some really good statisticians that look at this data, and if there's an issue that pops up, then we do something about it, because doctors and nurses and people giving the vaccine or people recommending the vaccine, no one wants to give a vaccine that's not safe. We do want to protect people, but it's got to be safe. And we've got really good systems of monitoring the safety and making sure things are okay. Next slide. Thanks, Lachlan. So if we have a look at what people are reporting, so this is from the OSVAC safety website. This is from the 9th of January, so it's really up to date. And we can see nearly 3,000 people that have had that Jynneos vaccine in Australia. And the blues for dose 1, the greens for dose 2. So about 47% said that they had some reaction after dose 1, but much less for dose 2. And you think, oh, gee, that's nearly half. That sounds terrible. But when we have a look, they're just little local reactions. So it's just where the needle goes into the skin. And when we have a look at other reactions, so fatigue, about 20% for dose 2, for dose 1, and about 10% for dose 2. So that's not unusual. So we're giving a vaccine. A lot of people get fatigue afterwards. If you actually go to the clinical trials of the Jynneos vaccine, about 30% of people said that they had fatigue afterwards, but also 20% of people that had the saline placebo said they had fatigue. So fatigue is an issue after vaccine, but it's not a huge issue. And then headache, muscle and joint pain. So they're very similar. So because we're simulating the infection, but in a way that's not dangerous, you get some of the minor side effects of a viral infection, which is what we're used to: fatigue, headache, muscle and joint pain, a bit of tummy pain, and a bit of fever. But you can see that most of those reactions are little local reactions. Now, you probably, a lot of people watching this may have had friends that have had the vaccine, and because no one was expecting an MPOX outbreak, so there wasn't much vaccine available globally or in Australia. So to make the vaccine go further, we were giving the vaccine just shallowly into the forearm here, and we could give a very, very small amount, and it worked just as well. It formed a little scar there, but just a few weeks ago, the Australian government managed to get more vaccine. So now we're just giving, it's a slightly larger dose, but like a conventional vaccine into the top of the arm, like you would have a tetanus vaccine or an influenza vaccine. So we're not using that method anymore, which means we're not seeing as much scarring. So if you haven't had any Jynneos vaccine yet, any MPOX vaccine, and you go along to one of the clinics or to your doctor and you get that vaccine, it will just be given a bit deeper, and the scarring won't be such an issue, and the side effects are not such an issue. And if you have had the first dose and it knocked you around a little bit, you can see there that those green numbers on the screen, the second dose is less problematic and doesn't knock you around as much. So it's really important you go get that second dose. You get about 65% protection with the first dose and up to 85% with the second dose. So and you can see there the little graphic on the top right. Some people have been to the doctor after they've had the vaccine, but only a very small amount. Most people cope with the vaccine very well. And down below the little bar chart there, about 4% of people report through this system that they missed work the following day after dose 1, and 3% for dose 2. So that's really well tolerated. But the good news is the supply of the vaccine's gone up. So we don't have to use the little shallow vaccine into the forearm, which means we're seeing less scarring. And again, the scarring you get from the vaccine, it can hang around for, we sort of say 2 months, but I know we sort of say 3 weeks, but I know some people have report up to about 2 months. But you think about if you weren't vaccinated and you got MPOX, the scarring you could get could be quite much worse. So you really don't want that scarring. Having the vaccine's much better. So we do keep a really good eye on safety. And this is like, up to the 9th of January, this is Australian data. So these are people, reporting to us. These are people like you, and the vaccine's really well tolerated. So we take vaccine safety really, really seriously. We're not going to recommend you go out and have a vaccine if we're not watching it and keeping a good, close eye on the data. Next slide. Thanks, Lachlan.
And I'll use this moment to plug, if you are going to get vaccinated and you do receive a text about a survey, please fill it out so we can keep these graphs as up to date as possible.
Yeah, good one. Thanks, Lachlan.
As someone who hates filling out surveys too, I have to say it's a really easy survey to fill out, not intrusive at all, and takes about 30 seconds. So
yeah,
well done.
Oh, that's good to hear. Thanks, guys. So we have a little bit further look. So that second bit there, so the symptoms reported. So this is the 2 lines there. Subcutaneous is the deeper one, and the intradermal one is the little shallow one that we're not giving anymore. So you can see the subcutaneous, about 1/3 of people report pain, but the little local reactions. So for the intradermal, the one that you probably know people who've had it, but we're not using anymore, redness, swelling, and itchiness is about half the people report that. But with the subcutaneous one, the deeper one, that'll probably be given into the top of your arm, those symptoms much less. So that's really good. And since we've been monitoring, only about 5 people have been to the emergency department afterwards, and they're often incidental, nothing to do with the vaccine. Next slide. Thanks, Lachlan. And you think, oh, but they're only small numbers, what's happening? So if we look at the United States, they reported just recently, last month, they reported that in the period between May and October in the US, they gave nearly 1 million Jynneos vaccines, and there was no extra bad events that they weren't expecting. So before the company put that vaccine on the market, the Jynneos vaccine, they had to do a lot of testing, and they did testing with about 7,500 people and didn't find any serious adverse events, only the ones we've been talking about. So fatigue, headache, a bit of tummy upset, and local reactions. And after giving 1 million doses in the United States, they haven't found anything sinister going on. So this vaccine has now got a good safety record. You're not the first person to be having this vaccine. If you've been hanging back and you think, oh, just wait and see how it's going. Well, the data, according to the United States, is that it's going really well. So now's a really good time to have it. Next slide. Thanks, Lachlan. So the government's provided the vaccine free for all sexually active gay and bisexual men, including cis and trans, sexual partners of all those people, for sex workers. And also, if you're planning an overseas trip, especially if that overseas trip is pretty exciting and you're going to have some dance parties and all those other things, then really encourage you to have that vaccine before you go. So you're not going to bring that MPOX back to Australia or back to your community here. So be really responsible, get that vaccine. And if you can get the second dose like 2 weeks before you travel, or if you're thinking, oh yeah, I might head down to Sydney for Pride in March, if you can get that second vaccine 2 weeks before then, that's going to get your immune system absolutely up and running, and you'll be as protected as you can be. And then you're going to protect yourself, protect the people around you, and that virus won't be spreading around. So if you think, I mean, this is an amazing opportunity. You think if you were around at the very beginning of some other sexual disease that bothers us all, like, syphilis or gonorrhea or chlamydia or something, and you had the opportunity to stop it, well, that's sort of where we're at. Like, this is at the beginning of this thing. If we all get vaccinated, the thing's not going to spread, and then generations in the future won't be plagued by MPOX like we are with, gonorrhea and syphilis and other things. So this is a great opportunity to just nip it in the bud with a simple vaccine. It's got a good safety record now. So before you travel yourself, or before you head down to Sydney for Pride, get that vaccine on board for yourself and for everyone else. Thanks, Lachlan.
No, thank you very much. So we'll just sort of end there on a couple of links and also organizations that you can contact if you do have any questions. I'll happily send these sort of out to participants after the fact, but Sexual Health Info Link is certainly a place that you can go if you have any particular questions. We actually had a question come through in the chat. Let me just bring it up. Give me a moment while I switch over here. So give me 1 second as I bring it up. So it's, can you choose where you get the vaccine? So the actual site. So you touched on that a little bit, that we were sort of receiving it here near our forearms previously, and now sort of the deltoid is the spot where a lot of people are choosing, or preferencing to get that vaccine. Is that correct? Yeah,
that's right, Lachlan. So the when we were doing the little shallow one in the forearm, some people were worried about like it's summer, wearing short sleeves and with that mark there. So you could actually have it below your scapula in the back. But now we're using the deeper one. Scarring's not such an issue, so it's generally given in the deltoid, in the top of the arm there. Yeah. So there is a little bit of you can talk to the person who's giving you the vaccine, but it would generally be given now that where we've got more vaccine available in the top of the arm. Sorry, Lachlan, you did ask me before about HIV, people with HIV. Yes, the vaccine has got a good safety record for people with HIV. If your HIV isn't well controlled and you've got your immune systems a little bit suppressed, you might not get the same protection as someone else with their immune system working perfectly well. But if you're taking your medication, that should be okay. But in terms of side effects, people with HIV are not going to get any more side effects than anyone else in the community. So absolutely safe. If you've actually had MPOX infection, you don't need the vaccine because the infection will give you the protection.
Yeah.
Thanks, Lachlan.
Thank you. Thank you for touching on that. That's true. So those of us who potentially have got MPOX prior don't need to be vaccinated, which is very interesting. We've had someone else ask, how long does it take for the vaccine to reach its full efficacy?
Yeah, so about 2 weeks after the injection, it works better. So if you're so you get about 65% protection 2 weeks after the first injection, but up to 85% after the second injection. And it's not perfect, it's not perfect. It's not going to protect everyone, but it will. If you were going to get a rip-roaring MPOX infection from some exposure, even if it doesn't work properly, it will make that a very, very mild infection. So if you think about it like a seatbelt in the car, yep, you get in the car, you put on your seatbelt. It doesn't stop every accident, but it means if you do bump into trouble, you're going to be so much safer and so much better off, usually completely unaffected. So it's not perfect, but it's a lot better than not having your seatbelt on.
Yeah, absolutely. Thank you. That's such a good sort of parallel to make there, I think, because that's a harm minimization technique that we're all very familiar with.
Indeed.
We've had a couple of community questions come through prior to the forum. I think you did a really great job sort of on the first one there. You sort of preempted me around, so how long is that scarring expected to take? I'll sort of jump in as well as someone who did receive sort of the early day injection in the forearm here. I would say that you were about right. So about 2 months for it to fade there. And I think it's also important to note from sort of that community perspective, when we do look at side effects and things like scars, I always weigh it up, and we did this with COVID as well. We do get vaccinated for ourselves and for our own health, but we also get vaccinated for the people that we love who are around us. And sort of the way that I like to think about it when I'm sort of tossing up, oh, is it worth me going out of my way to get this vaccine? I might get potentially a little bit unwell the next day. For me, I think about, I want to protect my partner. I want to protect the people that I sort of engage with, and continue to be able to go to those big dance parties, and make sure that not just myself, but that everyone else I'm around is okay as well. And that's how I sort of am able to sort of think about this and actually say, you know what, the side effects aren't actually that bad. And a little bit of a scar for 2 months is more than okay. I can tell people I got bit by a mosquito if they really are too sensitive about it. The other one as well, I think, in sort of following that same line, obviously as a community, it's very important to recognize that maybe not all of us are in positions where we can as openly talk about MPOX and why we might need an MPOX vaccine. And a big sort of reason for pause that some people may feel is around things like my health records. So do these vaccinations that we might potentially want to keep a little confidential have to appear on our my health records?
No, it's optional. So it's completely up to you. So there is, Australia has quite a good system of recording vaccinations. It's important to know last time someone had a tetanus vaccine or something like that. And that all is automated. But with this particular vaccine, it's completely your choice. If you don't want it recorded, you can just let the person who's given you the vaccine know. As long as the vaccine's in your body, it's going to protect you. And it's up to you. You have that option of not recording it if you prefer not to, and that's a completely reasonable thing. Yeah.
Yeah, absolutely. So the last sort of question we've had come through, and I think it's something that we could definitely talk about for a very long time, but is it important to get vaccinated if there aren't a lot of cases? I know a lot of community are saying, oh, well, there's not really that many or cases are declining. Is it still important to get vaccinated?
Yeah, it is, because the more we suppress this virus, the less people are going to get it. So we saw how, with how quickly COVID moved around the world. This MPOX, we're only talking less than 12 months ago, it came to our attention, like early last year, and it's moved around the world very, very quickly. So if we can suppress it and keep a lid on it by as many people getting vaccinated as possible, it just means it's not going to flare up in the future. I mean, I don't know what this thing will do, but we saw COVID changing all the time. If we can suppress it quickly, it doesn't get a chance to change all the time like that other virus. So it's just much better that we put a lid on it quickly, and we have that opportunity now, but it takes everyone cooperating, both for their own health. I'd much rather have some of those side effects we talked about than have some of the scarring from the infection. So you're much better off, and otherwise you're running, it's the Russian roulette thing. I could hop in my car now not put on my seatbelt and drive around Australia and come back and report to you in a month's time that I'm completely safe. I didn't need to wear my seatbelt. But obviously, that's really not a good idea. And because I did it, doesn't make it safe to advise you not to wear your seatbelt when you drive down the shop. So, you know, the vaccine is safe. It's easy to get. It's accessible. And it's a really good idea. So get your vaccine, put your seatbelt on, and then live the life you want. So that's sort of what it's about.
Yeah, absolutely. I think sometimes it's hard to think about prevention in health until you live through a global pandemic, and then suddenly like, oh, I get it. I understand now. And I think we've had far too many years of not being able to live the lives that we want. So so thank you for bringing that up, because I would like to return to partying without any worries anymore.
Yay. Absolutely.
Thank you so much, Patrick. I'm now going to pass on over to Trevor Slattery, who I mentioned before works for New South Wales Western Local Health District. Trevor's here and going to present a little bit around on how to access the vaccine within Western New South Wales. So for people living in or around Dubbo and Orange.
Thanks, Lachlan. So the way you book into a vaccination clinic, because we only have limited spaces and times that we're able to offer vaccinations in our clinics in this area, is to use the website. So I have checked that QR using the screen, so you can actually get your phone out and log into the website as we're talking about it. But basically, you create an account, you enter some information through the website, which will be some of your personal details, and then that will allow you into the booking segment of the website, and that will enable you to pick the clinic in your area and the time and the day that's available. So in our area, for instance, there's a clinic next Tuesday where I'm getting my second dose. So when I booked it back before Christmas, I was able to go, that's the day that I know that I'll be in Orange, because that's where I'm getting the jab. And I was able to select that clinic and the time. Now, if you were going on holidays, for instance, and you knew that you were going to be in an area at a particular time, then you've got the option of saying, are there any clinics happening in this area? And trying to book into another clinic outside this area. But for the purposes of this talk, we'll talk about the two clinics that we're offering them in this LHD, which is Dubbo and Orange. You will need some information when you log into that system. So it's going to be like name, age, Medicare number. There'll be some other information which is around your sexual history and your partners, and that's really important to basically make sure that the people who fit those eligibility criteria that Patty talked about are getting reference on the vaccines. So we're making sure that we're getting the best coverage that we can with the people who are most likely to be at risk. They're the contact details for the local clinics that will be offering the vaccinations in this area. You can't, I did clarify this with the CNC today, you can't just ring up and book in over the phone to get a vaccination. It's only being managed through that website in terms of making a booking. So it's not a fun process. It's a couple of click-through screens. It's not the least clunky website that I've ever used, but it is an important process to go through. And once it's done, it'll send you SMS reminders for your clinics. So you know when it's coming up. You'll get confirmations. They'll send you, they'll be able to use your phone to let you know about, asking about side effects, that kind of thing, to make sure that you're okay after it happens as well. Any other questions around that, or should we move on to the next slide? You don't need a Medicare card, by the way. I know I said you need a Medicare card to register. You don't actually need a Medicare card for the vaccination, though. You do need proof of ID in order to register for the vaccine.
Perfect. So you have sort of preempted my next question for you, which is, do you need a Medicare card? And you will see, like Trevor said, as you go through, it may ask you to provide your Medicare card details, and you will have an option there as well to say, look, I'm not able to provide them at this time. The other thing I think as well is around legal names. So we have many trans and gender diverse community members who may use a name that is different or than what their legal documentation is. I suppose we've had a number of questions come through around, when I am booking, do I have to use my legal name? When I'm at the clinic, do I have to use what's recorded on my Medicare certificate?
Yeah, so unfortunately, lots of the New South Wales health systems that we deal with are playing a big game of catch up in terms of what our data collection standards are like. It's not an ideal system, so depending on the systems you're working with, you may need to use a legal name in order to do the registration process. But when you come to the clinic, the clinicians, just let the clinicians know what your preferred, what your name is, and they will use your name as opposed to what you've had to register with. So that's a fairly common process at our sexual health clinics, where we've got very experienced staff, and that will answer the next question as well, is the people who'll be greeting you and administering vaccines and working with you at these clinics are very, very experienced nurses and doctors who work just in the field of sexual health. So they've got lots of experience, not only dealing with monkeypox, but providing vaccinations and all the other intricate and specialized nursing fields and clinical fields that surround sexual health. So they're very used to dealing with what you might consider an awkward question is just normal question for them. So if there's anything you're unsure of, or you've got any other follow-up questions, or you're concerned about something, there's no such thing as a silly question. So they'll be more than happy to answer you and support you through the process.
Yes, that was my other question. There's a second part to that one. Is I think we can all remember, certainly early days, getting a COVID vaccine, you have to take nearly an entire day off work. And for myself, I remember traveling all the way down to the Olympic Park in Sydney to get my first COVID vaccine way back in the day. So can you sort of talk us through what the process is of getting vaccinated, and sort of how long are we looking at taking? Do people need to take that sort of half day again?
Look, it's depending on how far you need to travel in this area is going to be the biggest factor in terms of the amount of time that it takes. The actual process itself will tend to take about half an hour, because a lot of your registration has been done prior. You'll sit down, they'll run through questionnaire just to make sure that we're not missing anything important around contraindications and possible interactions before you get the jab. So that's another safety measure. But the longest part of the process is actually waiting for 15 minutes after the jab to make sure that you're not having any reactions. So in this area, the biggest time commitment is actually traveling to and from the clinic.
Yeah, thank you so much, Trevor. So that probably brings us nicely into sort of the next section. And you mentioned it a little bit as well, is that in Orange and Dubbo, we're sort of providing vaccination within the sexual health clinics themselves. So I was hoping we could sort of take this moment, because while MPOX is very important, it's also important to remember, like Patty said, there are many sexually transmitted infections which are not vaccinated against. And there are many other things like gonorrhea and chlamydia and syphilis and stuff that we also might want to keep an eye on. I was wondering if you could sort of talk about sexual health clinics in Western a little bit more general, and sort of what's sort of out there.
Well, there's certainly STIs out there. Just because we're in regions doesn't mean there aren't things that people are contracting and spreading around and sharing the love, so to speak. And there's also lots of populations who are, going down to Sydney and partying. So just because we're separate geographically from Sydney doesn't necessarily mean that Sydney doesn't come to visit. We've got not 2, but 3 sexual health clinics in the area at the moment. There's only 2 providing MPOX clinics, which is Dubbo and Orange, but we've also got a clinic in Lightning Ridge, and we've got a nurse that's also based out in Burke, but that position is currently vacant. So there's 4 kind of bricks and mortar services, so to speak, across the area, and then we've got a whole bunch of outreach services, like for instance, going and providing clinics at Headspace at various places around the district to enable different groups of people to access services more easily. What's important? So the list on the left is kind of the core services that are offered, and the list on the right are around things that are kind of added services that we can and do offer when we have the capacity to do so. So it's important to remember that the service is free and confidential. It's free to access the clinical services. If you require a script as part of the service, then it's the normal cost of a script that you would require. There's no Medicare card required, which is important when we've got some of the people we're trying to get tested more might be visiting from overseas, for instance, and don't have access to Medicare, so they can come to our clinics, and we would definitely like them to come to our clinics. It's important to know that it's staffed by specialist doctors and nurses. So we've got an agreement with Sydney Sexual Health. So when you see the doctor at our clinics, it's actually a Sydney Sexual Health doctor who's coming out to visit. And if they're not visiting in person, then they're available via telehealth and on the phone. But our specialist nurses are very, very experienced, and they lead the clinic with the support of those doctors. So certainly ready and available to answer any questions and provide you with any services you might require.
Excellent.
Yeah.
Sorry, you go.
So core services are mostly around sexual health screening, management and treatment. That includes things like helping you to do contact tracing and inform partners as well. So if you do happen to come up with a positive result, then they'll not only get you in and treated, they'll also help you contact partners and so they can get treated as well. HIV management, which includes also, particularly with new diagnoses, making sure that we've got access and wraparound services to support that person and anyone who might be providing clinical service to that person. And also some vaccinations depending on the group and the eligibility. So, for instance, when I first went to sexual health, they gave me a Twinrix vaccination, so I was vaccinated for Hep A and B. PEP and PrEP access, which I believe Lachlan's going to touch on a little later today, so I'll leave that one for the moment. But we've also got one of the increasing services around trans and gender diverse care and referral, which was a bit of a first for the state. And that's now being rolled out across the state in other ways. So we're very, very proud of the fact that we've been able to expand that service, even though it's unfunded. We've been able to get that service up and running, and it's only grown in leaps and bounds since that was commenced. And other kind of wraparound services like family planning support, hepatitis screening, and of course the needle and syringe program, which is where I do a lot of my work. Next slide. All right, so in terms of accessing, you don't need a Medicare card. Thanks to COVID, we've actually changed our services a little in that we used to offer lots of walk-in services, but thanks to COVID, we started doing a system where you call up and you kind of get a pre-assessment beforehand, which actually cuts down a lot of time and waiting time when you come to the clinic. So you can have a phone call, talk to the nurse, they'll assess what kind of screening you need, whether it's asymptomatic, whether you need to see someone who can actually do any swabs or take a look at it. And that will actually speed up the process when you get there, because you've already done all of the discussion before you actually get through the door. So less sitting around in a waiting room feeling nervous and wondering who might see you there, and more just getting in to see the nurse and out and on with your day. So we offer screening on sites. You can get your results via SMS, and we've got the treatment and partner notification. So in terms of who should come and see us, everyone's welcome, but obviously there are some groups, for instance, men who have sex with men, who should be considering more regular screening. And we've also got a bunch of groups that there's, state strategic documents that New South Wales Health says these are the people you should be focusing on. So while we don't want to turn people away, we've also got very limited capacity. So we've got particular groups that we try and encourage to come through our doors more than others. And there are groups of people who might find it more comfortable going to their GP. If they don't feel comfortable going to the GP, they can still come and see us. But we're particularly interested in groups like people who've been diagnosed with an STI in the last 12 months, sexual active people under 30, people from culturally and linguistically diverse backgrounds. I touched on the people traveling from overseas, or particularly traveling from overseas that have high rates of particular infections, because if they're coming over for holidays, for instance, and having a particularly fun holiday, then they might have also brought some things with them from overseas, and we obviously want to make sure that they're safe, they're having fun, and so their partners are as well. Trans and gender diverse people, as I said before, sex workers. You might think that might be, again, a metro-focused kind of area of work, but you only have to look at crossroads, like regional towns that are crossroads on highways, to know that sex work is certainly alive and well in the regions of New South Wales. That's probably about it in terms of who should visit, unless there are any questions coming up in the chat, which there are. Tom, thank you for the question. They do certainly do treatment for STIs. They can, anything that you can get treated for at your GP, you can access through the Sexual Health Service. And what I've found talking to people over the course of my work in the sector is that if you're getting screened at the GP, often GPs don't have a speciality in sexual health. So they might screen you for HIV, but not realize that they also need to screen you for gonorrhea and chlamydia, for instance. Or they might screen you for gonorrhea and chlamydia because they assume who you're having sex with because they're not having the conversation, when they really should be screening you for gonorrhea, chlamydia, syphilis, and HIV. So by coming to a specialist sexual health service where you're dealing with nurses who this is what they do, this is what they talk about day in, day out, they'll have a very comfortable chat with you, and they'll assess exactly what you need to be screened for. They won't screen you for things that you don't need to be screened for, but they'll make sure that things you do need to get screened for are screened for together, and that it's as quick and painless as possible. Hopefully not painful at all.
Thank you for that. The other thing, I'm not sure if we've touched on it, is around cost. So it's really important, I think, that people should know that the MPOX vaccine is free. So we don't actually have to spend any of our own money to actually receive this vaccination. It's a fantastic initiative through New South Wales Health. Unfortunately, not all vaccines come under that. And especially not all vaccines around STIs as well. As someone who was just a little bit too old to have received all the Gardasil needles through high school, I'm a little bit salty about that. But nevertheless, we move on. But yeah, look, Trevor touched on it really, really well, and it sort of is such a good point, is that these clinics are very experienced in the work that they do. They're very experienced in working in regional settings as well, where we understand that confidentiality is a really important factor in a lot of people's accessing of these services. So do feel confident either when you're getting vaccinated, if you haven't engaged with regular sexual health testing prior to this, or maybe you've had a couple of years where you've taken a break, this is actually a fantastic time to re-engage, and that sort of brings me quite neatly into my next section, which is all about getting ready for World Pride. So the whole reason that we're having this big push for vaccination is because we have a whole lot of people coming to New South Wales from all over the world. And we want them and ourselves to have as much fun as possible when we're down in Sydney. A big part of getting ready for World Pride is not just buying chiffon and biodegradable glitter, even though that is a very important part of getting ready for World Pride, or at least it's my very important part. The other really big thing is to make sure that we are looking after our health, and a big way of doing that is around regular sexual health testing. So the recommendation for gay, bi, and queer MSM is about 4 times a year for regular sexual health testing. So once every 3 months. And the reason for that being is that we know that the largest sort of window for HIV is around that sort of period. So we know that if we're getting tested once every 3 months, we're gonna make sure that we catch anything. However, when we're speaking about HIV, we are now in this incredible space, and Patty touched on it earlier, during the beginning of the epidemic, where we really didn't have a lot of the great medication that we now do. We are now in a space where we have very, very effective preventative health measures. So in the same way that we should really be pushing to get MPOX vaccines as quickly as possible, so we can squash it before it has a chance to spread and potentially mutate like COVID did. So now we're up to strain 7, 9, 10. We have a great opportunity to squash HIV, new infections of HIV in our communities through really cost-effective and effective preventative drugs like PrEP and PEP. So PrEP, for those of you who are listening who are potentially not aware, is a pre-exposure prophylaxis. So it's a form of antiretroviral that we can take in a number of ways. For many of us, we'll choose to take it daily, so 1 pill a day. For a lot of people, however, especially living out in regional communities like Dubbo or Orange, where sexual contact for whatever reason, might not be as common, there is the choice for us to take it on demand. So we can take 2 pills up to 2 hours prior to sex, one 24 hours after that, and one 48 hours after that. The way to remember that is 211. So it's like the Azealia Banks song, but sung wrong. If any of you have ever heard that song, you realize how funny that joke is. The other really big one that I think a lot of people, especially in regional communities, find helpful is periodic. So we may be sort of based in very far Western communities where we're not necessarily engaging in regular sexual contact. We're going to go down to Mardi Gras. We're going to have a great couple of days. So we're going to take PrEP while we are sort of in that period. So we're periodically taking it. So we sort of take that double dose to start and then continue on through that period. And then when we're done, we can stop taking PrEP and only restart it if we choose to or if we think it's necessary. The other really important one is post-exposure prophylaxis. So if we've had sexual contact with someone and we believe there might be a risk of HIV transmission, we can choose to take PrEP. So it's the same medication that PrEP is we just take it after the incident. You can take it within up to 72 hours after sort of that incident occurs. And if you are struggling to find it, it's available in every emergency department in Australia. So that's important that these drugs are available and that we're also very aware of them. They're incredibly effective at preventing HIV. So as we sort of gear up to World Pride, it could be a really good time to have a think, is this something that's the best decision for myself? And like we said, you know, with getting vaccinated, it's a great opportunity to have that conversation with the nurses in Orange and in Dubbo. They're very, very experienced with having conversations around PrEP and PEP. And they can sort of go through the process of actually getting people onto this medication if you choose to take it. Any comments from yourself, Trevor or Patty, around this medication and what it offers for us?
I just think it's, you know, thinking back to when I started in the sector and we didn't have access to PrEP and hearing the first kind of murmurings of we're going to try and do a study on this and see if it works, and everyone in the sector was kind of a bit skeptical. And then now we're talking about ending transmission of HIV for, you know, for all intents and purposes in this country in the next few years. And you look at PrEP came in and you look at the rates of transmission just plummeting in the communities that are using PrEP. So it shows that it's really, really effective if it's used in communities, and that, you know, it's a game changer in terms of, you know, where we were even 12 years ago. You know, we didn't have these tools at our disposal in the way that we did. And it's clinics like our clinic in Dubbo and Orange that actually participated in those studies that helped build the evidence base that gave us access to it. So have a chat about it, even if you're not ready. You know, before I started on PrEP, I had multiple conversations with the nurse to actually say, is this something for me? Is it something that's worth for me doing based on my risk factors? And, you know, they're there to ask questions of, and they'll give you a straight answer.
Yeah.
So to speak.
Yeah. Thank you for that, Trevor.
Yeah, thanks, Trevor. That's great. I mean, you don't want to bang on about the past and a history lesson, but, you know, I'm more than twice the age of Lachlan and Trevor, and I was around when HIV first started, and I looked after a lot of young fellas that died very quickly, and it was just tragic and awful. We don't have that now. And the PrEP and the PEP and having that and taking those pills and doing the right thing for yourself is the reason why. And again, we've been able to, not through vaccines, but through these medications, just completely, HIV is just not the game it was back in the day when and I can picture the faces of young men that never grew up because they're exposed to HIV at that time. So please do that. And what Trevor was saying about the clinics, the sexual health clinics are fantastic. They're run by specialists. They're really sensitive. They're really confidential. So I live in a small regional area, I know the GP, I know the GP receptionist. If you're worried about your confidentiality in telling your story to the GP, the GP can look after you. If you're happy with your GP, that's fantastic. Then go for it. Talk to your GP. But if you're a bit worried because it's a small town and you know everyone, then these sexual health clinics are just fantastic. You can be, like Trevor said, you can be whoever you want there and talk really open and honestly and get this protection and help. And they just know so much and able to talk about things really open and honestly. And then again, you can then be prepared to then live the life that you want. And that's sort of what it's all about. So if you're in a small town and worried about your local service and confidentiality, then those sexual health clinics are just fantastic in terms of their expertise and the confidentiality. You can really go there and feel very, very comfortable.
Yeah,
and that's part of the reason why we don't have, aside from the fact that we don't have that many nurses, but we don't have, walk-in bricks and mortar sexual health clinics in a lot of small towns because they are so small and because we're very conscious of the confidentiality concerns. And that, if you live in that town, your ability to be private about your goings on is very difficult. So, we've also got an excellent team of Aboriginal sexual health practitioners that work with the nurses. So they go into, towns of 300 people and they talk about stigma and they decrease people's anxiety around these things, and they're going in and providing services where otherwise somebody would have to try and anonymously explain to their family why they're going to a town a couple of 100 kilometers away. What are they doing? It's we're there to keep your privacy private, and if somebody's doing what they shouldn't in terms of confidentiality in another service, we're the ones who will actually come down on them. So
perfect.
Secret's safe with us.
And if you are having, or you would like to know how to access any of these sexual health testing services or any sexual health testing service in the state, please get in contact with ACON. That's certainly some of the work that we do is helping connect community to these services, so we can help be sort of a little bit of the bridge between the clinical and the community. Following on from what Patty said around the change, I think, in particular, I'm very lucky in the sense that it was only a few years after I turned 18 that the clinical trial for PrEP started. So for those of you, I believe that was around, it was 2016, 2015, wasn't it? So I can sort of remember the sex and the conversations I had around sex prior, and very, very different to afterwards. I think I often refer to PrEP and PEP as the sexual renaissance because it has really changed the way that we engage as a community, thinking about HIV, but thinking about STIs more generally as well. And beginning to really have that conversation around stigma and the impact that actually had in preventing people from getting tested and from even having that conversation at all. And it's really important as to now why we can sit and talk about MPOX and actually respond to it really, really quickly, is because so much incredible groundwork has been laid, not only by the LGBTQ community in large, but also by the incredible community of people living with HIV who have done so much advocacy and work to really sort of talk about their stories and destigmatize sexual health in general. Did you have something you wanted to say, Trevor?
Oh, just that it's been a sexual renaissance in many ways. That also comes back to the importance of the reasons why you might take PrEP are also reasons why you need to make sure that you're thinking about regular sexual health checkups as well, particularly regionally. I was only talking to someone earlier today who isn't in this state but certainly works in a region, and of the last 10 people that she's screened for syphilis, 5 of them had syphilis. So just because you're in a regional town doesn't mean that the blue pill will protect you from HIV. It's not going to stop the other things you can potentially be contracting or spreading to partners. So regular sexual health checkups are important.
Yes, thank you for bringing that up, Trevor. Unfortunately, PrEP does not protect us against STIs like syphilis. However, many, if not all, or a vast majority of STIs are treatable if we catch them early on, especially syphilis, if we catch it early on, is very, very treatable. I think it's almost one of the first that we got a really good treatment for, which is fantastic. And what's really great about sexual health clinics is that, like they said, not only are they confidential, but they're also able to sort of help you with that treatment pathway. So if you do have a positive result, it's not sort of the end of the conversation. It's actually just, you know, sort of one step before we then able to access or organize treatment for you, and then to hopefully then make sure that we clear that STI as quickly as possible.
Get you in, get you treated, get you back out there.
Yeah, exactly. Another sort of really big component to staying prepped, getting prepared for World Pride and Mardi Gras is that yes, condoms still do exist, and that it is your choice to use one, and don't feel shamed or pressured to not use one just because you are on PrEP or your partners are on PrEP. It's certainly nothing to feel shame about if you choose not to use one, but it is something to think about that yes, condoms are still a very, very effective against many STIs, not fully effective against MPOX, unfortunately, which is why we still get vaccinated. But yes, it's still incredibly effective against preventing STIs and HIV. Another side of that conversation, and we touched on stigma, is to now know that HIV antiretrovirals are incredibly effective. So the treatment for HIV has completely changed within the last few decades. It's now so effective that many people living with HIV are able to achieve in New South Wales what we call an undetectable viral load, which is to show that the levels of the virus in their blood are so low that it cannot be detected. In these instances, they are not able to pass on the virus. And it's really important that while we have this conversation around MPOX and not stigmatizing people who are, you know, who may or may not contract MPOX, it's really important to not stigmatize people living with HIV. You know, and when we go out into World Pride, let's go out as our best selves. Let's leave terms like, you know, dirty or clean or things like that at the door, and actually sort of have this conversation in a way that's respectful and understanding that the only thing, I say this quite a bit actually to communities, the only thing an STI result or a HIV result tells you is about a person is that person has HIV or that person might have had an STI. It's nothing indicative on the character of that person at all. And that leads me into actually a question that I got from the chat. Someone has privately messaged it to me, which is really nice. In that, how do we have the conversation around MPOX vaccinations and asking our partners to sort of surmise the question there. So thank you to the person who sent that to me. I think it's really important to talk about, and leads us sort of nicely into another sort of section is, now that we are vaccinated, how do we talk to our partners about that, or our potential sexual partners? I'll open that up to the panel here around your thoughts on that and talking about vaccinations. Does anyone want to jump in first?
I think one of the things that COVID has done for us, having worked in preventative health for a long time and kind of been the poor cousin of so many other aspects of the health service, where people don't actually think about preventative health until after the thing that prevent happens. COVID has actually helped not only raise the profile of why we do prevention in health, but it's also made it a lot easier to talk about vaccines in general. Granted, some of those discussions can be a little more animated than they probably should be, but I think Patty's provided an excellent overview and some good tools in terms of ways to talk about why vaccines are a good thing and what vaccines are actually attempting to do. The seatbelt analogy is actually a brilliant one. I think I'm going to steal that in terms of saying, you know, it's not just for me, it's also to protect you as a partner or people that I'm associating closely with, this group of friends, whether that's a recognized partner or not. And yeah, it's really opened an opportunity in not just MPOX and vaccinations, but talking about preventative health in general, and sexual health in general, in terms of what we're doing for ourselves and for our community, in terms of the choices we make and the way that we protect ourselves.
Yeah, fantastic. Thanks, Trevor. Did you have something to add there, Patty?
Yeah, I think I mean, the beauty of vaccination is it's going to work for you. So, you know, if your communication skills aren't fantastic and you can't broach that subject, well, at least you got it on board yourself, and that's the best start. You know, so that's really important. But yeah, encourage you to have open communication if possible. If you're able to, but I mean, I hate to give another to show my age, another dated analogy, but you think of Princess Di you know, if she didn't get in the car with the drunk driver, and if she had to put a seatbelt on, you know, she'd probably still be around and leading the world in and being a great partier. But you know, she you know, the guy was drunk, she got into the car and she didn't put a seatbelt on, and that was that. So thinking about your own health, you shouldn't be embarrassed about that. Like, you should be able to speak up and say, oh, you know, you know, and discuss with someone. But you know, if you're at a big dance party, and sometimes that's hard, you can't even hear someone, never even have a discussion. So that's why vaccinating yourself is really, really important. But with close partners that you're able to talk to, I think it's a really good idea. If you're both protecting each other, or a group of you are protecting each other, then that's just lovely, and I think that's the way to go. But at least get the protection on board yourself. That's important.
Yeah.
To come back to the privacy and confidentiality aspect as well, I mean, it's also your decision. If you want to get vaccinated, then that's your choice. Obviously, if your partners want to get vaccinated, then that is awesome and that's great. But their decisions shouldn't prevent you from making positive health decisions around, you know, doing what's right for you in terms of feeling safe and secure and protecting yourself.
Yeah, absolutely.
It's not their decision to make on your behalf.
Yeah, absolutely. And I think as well, if we think about COVID, there's been so many great technological updates in the way that we use, in particular, hookup apps have actually changed really quickly. I remember back in early COVID, when people had to like change their names on dating apps to show that, to indicate that they were vaccinated against, they used the green tick for COVID, they used the monkey emoji to show for MPOX, which just shows that the queers move faster than COVID does. But the other thing now is that if we use Grindr as an example, inbuilt within that, it actually will let you know, when your last sexual, you can indicate to anyone looking at your profile when your last sexual health test was, if you are living with HIV or have a positive undetectable, if you have an undetectable viral load, whether you are negative on PrEP, and it also lets you know, let your partners know whether you're vaccinated as well. So it's a great way of having the conversation without having the conversation, and I really encourage you to utilize that. On profiles and things like that. Like Patty and Trevor said, it's your health and you should feel confident talking about it. In the same way that we're like, I spoke earlier, if you choose to use a condom, that's your choice, and you should feel sort of informed and supported within that choice. It's also your choice to get vaccinated, and you should feel supported to say, hey, look, I am vaccinated. And to share that information first, and then potentially ask your partners is usually the best way to go about it, rather than asking as the first message as well. I don't recommend that being your opening line. But yeah, certainly sharing that information and letting people know that, hey, this is something that's important to me, and so that's why I'm letting you know it about myself is a really great way. If we don't have any other community questions, I would really like to thank Patty and Trevor for joining us today. It's been an excellent discussion around the importance of vaccination and the importance of sexual health services, especially out in rural and remote communities. And I know that I learned and got a lot out of it. So I really hope everyone watching got a lot out of it as well. So thank you very much for both attending here today. This is not the end. If you would like to still stay in contact or keep in contact with ACON Hunter, we have our social media page on Facebook, so we semi-regularly run these sorts of presentations, and any new updates around sexual health testing or MPOX or anything around that, we will definitely push across our socials. But thank you very much for joining us today. We're leaving a little bit early, but no one's ever been mad about something finishing early. I would once again like to thank the panel for joining me.
Thanks for having us, and thanks for all
right. Thank you.
Thanks, Lachlan.
Awesome. Thank you very much. Bye-bye.